Hi guys, I wanted to make a quick video talking about the laid back position. Um, I know that it's kind of a common position to use in the hospital, but we don't really think to use this position, this breastfeeding position at home. And we most likely because we don't have, in the hospital you have the reclining bed, and so it's easier to recline and be comfortable in a laid back position. But the laid back position is one of the most natural breastfeeding positions for a baby, and probably one of the easiest positions for the baby to be able to latch correctly and not to have as many issues latching and struggling with latch. If you find yourself struggling with latch, trying that laid back positioning might really help. I will try to put a picture, maybe the thumbnail will show what the laid back positioning looks like, and if I can, insert a link in the description below that you can kind of go and look at videos of laid back positioning. But basically, you're reclining in your bed or in a chair. You will have pillows around you that would be supporting you and your baby, your arms. You want to be comfortable. You will be laying back, but you want to be comfortable. So you want to be able to be in that reclining position and have enough pillows around you that you have the baby there on top of you, but you are going to be supported by the pillows. So you're not going to really have any pillows necessarily on you, but you're going to be leaning back and the baby will be laying on your chest. And it is basically gravity will be keeping the baby on your chest, and you'll just kind of be there guiding. In that position, the baby is able to use their hands to touch you, to feel you, and their face is then to your skin and your chest, and they're able to kind of crawl to the breast, smelling you, and using their hands to find the areola and to find the nipple, and then they latch perfectly because of the way that they're positioned on your chest. They have to lift their head a certain way in order to get their mouth open wide enough to get onto the breast. It's the actual latch, the type of latch that a baby needs in order to get enough breast in the mouth so as to pull down enough milk out of that breast. So I will put a link in the description that has what this laid back positioning looks like and how it works. The video is by Nancy Moorbacher. She is a very well-known IBCLC, and she's written many books to help train a lot of breastfeeding peer counselors and certified lactation counselors, and also the IBCLCs, or Internationally Boardified Lactation Consultant. And so I will put that information below just so that you can kind of see a visual of this laid back positioning. I just kind of wanted to talk about it because many times we think of the cradle hold, we think of the cross cradle hold, we think of the football hold or the clutch hold, but we don't talk a lot about this laid back positioning. And it's very similar to the skin to skin positioning, just in that same position that they put the baby in for your very first feed after the delivery. So it's very similar to that, and it's probably one of the most natural positions for the baby because a baby actually uses their hands to find the breast. When you're using the cradle or the cross cradle, even the clutch, the babies their hands tend to get in the way, and you feel like you're battling their hands, trying to push their hands away so that they can find the breast. But they really need to use their hands. That's their natural way of finding the breast and latching correctly. So this laid back position allows them to do that. So please check out the video in the description below as to how kind of get a good visual. And if you have any questions, feel free to comment below. I hope that this just kind of gives you an idea of another position to try, especially if you are struggling with latching or just struggling with positioning in general. It's also a really good position for large-breasted women, just because it's easier to get the baby to latch and be able to see the baby latched and feeding, so that you don't feel like sometimes it's hard to see them when you're bigger breasted, or you feel like they're not able to breathe and you worry about that. With the layback positioning, you don't have to worry about that. So definitely check that out, and I hope you enjoy the video, and I will have another one up as soon as possible. You guys have a great day, and I will see you in my next video.